I'm Pranjal Sharma, an author based in New Delhi, India. Today, we are joined by Abhishek Mukherjee. He is the Chief Product and Technology Officer at Verato for an in depth discussion on trust, identity, and technology, how to transform patient journeys in a digital era. Avi, thanks for joining us. And to kick things off, I mean, can you tell us a little bit about your own role at Verato and what does this identity management really mean?
First of all, thank you, Pranjal, for having me. Delighted to be in this conversation. Uh, so, as you mentioned, my role is Chief Product and Technology Officer of Verato. So, we are identity data platform, and our focus is mastering data for customers, mainly in healthcare and some outside healthcare, and connecting uh, the customer journey across all the interactions these organizations are having.
So, what does this mean for a consumer? If I look at it from the consumer's perspective, when you talk about identity management, I mean, before we get into the enterprise part, from a consumer perspective, what does it allow me to do?
It's basically powering exceptional experiences everywhere for consumers. As the consumer who is searching about physicians in the website and then calling and booking the appointment with the right provider, seeing that physician getting the prescription, picking up these medications, and coming back for a follow up visit with the right follow up reminders at the right time. All of that is connected by identity, and that's what we power. We power the most important thing we believe, which drives everything, is knowing who is who, and that's identity.
So, you would say that it was overlooked so far in the sense that healthcare services were not focusing on it adequately, and now with this effort, you see a foundational change in the way it is going to be managed.
When we talk about overlook, I think healthcare organizations were focused on identity inside their four walls. And since COVID pandemic, telehealth, even before that, there were telehealth around and remote patient monitoring and other uh, at home services. But COVID kind of pushed these technologies more at the center of patient care. So now patient is not even getting care just in a hospital or a clinic setting. They are they need care everywhere using their digital health tool on their phone. It might be certain devices which they are wearing, or certain chronic care patients are using some kind of diabetic managing and monitoring devices to a care, of course, inside the hospital and clinic. So now these health systems need to understand data about these patients, which is outside their four walls. So that's why identity and tracking these patients' information outside the four walls becomes very important.
Can you share an example or a case study? Like, how would it impact anybody that's a senior citizen coming into a healthcare facility? I mean, any example to illustrate how the new process will work?
I think the three big examples which Verato, or as well as overall identity data management, helps. First is, as I mentioned, customer experience. Uh, the patients are interacting and booking appointments now on their phone. Also, sometimes calling in, uh, and of course, they are verifying the appointment when they are in front of a physician. uh, these patients are looking for the same personalized experience they have from other retail websites and where they're shopping online. That similar experience are now getting introduced in healthcare. So they are looking for that tailor-made, personal, strong, personalized experience. Now, uh, without identity management, I'll give you an example of our client in Jacksonville, Baptist Health. These patients are coming in for imaging order, and the results need to be shared with their partner hospital, Nemours Children. And it's such an interesting story where Baptist and Nemours are actually next door. There is actually a highway between the two health system location. And there is actually literally a bridge connecting these two health systems. But the data to go from one health system about this imaging order, you need to fax this manually, sense that imaging order, get the results sent to Nemours, and then any kind of follow-up information goes back to Baptist. That has taken weeks for initial new patients, and especially for children, which also needs consent and other workflows with their insurance company. With identity management system, uh, these interoperability is seamless. When a patient comes uh, into a Nemours and they have been a Baptist patient before who actually has medication or image orders at Baptist, the data flows seamlessly, uh, and the imaging order can be sent from Nemours to Baptist for a pediatric patient in a minute. So this is, as I mentioned, I think the experience part of from a patient standpoint improves significantly once they start using identity data platform.
So, what kind of information does the patient have to share? Because one of the concerns always is about managing the data. If it goes through various systems, the traceability, the accountability, the storage structures, and of course, the main point that a patient would like to have is control over his or her data. Now, how does that play out in this new system?
Yes, I think a good identity data platform need to manage consent and preferences, and also enable workflows and automation of those workflows. Without that, every time someone has to manually, check and verify what data can be shared, who is authorized, as well as preference for the patient, whether some of this information can be, called and left on a voicemail or a text message. So all these now are part of identity platform, along with the workflows, which helps to automate these processes. So it's I agree with you. It's super critical to have these workflows enabled with consent and preference from the patient as well as providers. Sometimes the providers looks for a certain kind of patient at a certain clinic. So if I'm a cardiology provider and I also see pediatric children, and in a certain clinic, I don't want these patients to go to a different clinic, though I am available in both the clinics, in a particular day of a week. So these provider preferences, patient preferences, their family relationships of householding, and who is in the part of the household, who is a minor. Those workflows are super important. So it's really get personalization includes consent and preferences.
So, I mean, what's the status of adoption this across the industry? It's not just about what's happening in the US, this has application across the world.
Yes, I think the healthcare workflows are creating so much data, and especially with the AI boom which we are seeing, most of the organization really are data rich, but insights poor, which we always use, with our customers, and these these data sets really in need for any kind of AI or workflow automation, uh, a comprehensive identity platform. So the impact, Pranjal, is everywhere.
And you see healthcare organizations across the world warming up to this. How do you see that escalating and accelerating across these systems? Because as you also said that these are global facilities, global linkages. Patients can move from one institution to another. They can also go from one region to another. Do you see national and global institutions adopting this in a way that there are common protocols everywhere?
Absolutely, I think CMS in US is implementing TAFCA and FHIR standards, which are all interoperability standards. Similar interoperability standards has been adopted in Europe and Canada. The developing countries are a little behind, but not that much. There is a lot of push in India and China to adopt electronic medical records. Uh, as digitization becomes, center, I think India is really leaning in on that. Identity and cross-platform identity interoperability will be a center point for any initiative.
Yeah, you're right, because there is a national digital health mission in India. But tell us about the next phase of this. Of course, there is Gen AI, which is coming in. How do you see that impacting the processes that you have detailed?
I believe that to power real-time decision making, a comprehensive, clean customer data is a center point for any analytical AI data applications. Um so as organizations are adopting this technology, uh, it starts from removing duplicate and incomplete and mislinked records from a patient standpoint. It can enable detecting and preventing fraud or revenue leakage. When I say revenue leakage, if a patient is uh, going for surgery, but the post-acute care and rehab is done in another clinic, which is not affiliated to this health system, so that revenue leakage can be identified. So it also helps in business. Uh, it really is a centerpiece for streamlining compliance and reporting, which we discussed, to help in consistent audit. So even with AI and all the Gen AI boom, compliance and consistent access controls of this data and tracking will be super important. The other thing is happening across the globe is there's a lot of consolidation in healthcare. M&A is a every month, everyday activity. So quickly linking information from the acquired business entity and their existing business profile with the new business is also a center point of identity data management. And finally, forecasting, pricing, customer, valuation models, which AI is, also enabling. That also needs, those data science and AI initiative needs clean customer data. So I see all, it's actually amplifying a need of a clean identity information.
So I think that's a great point you made about global investors and consolidation in healthcare industry, because it's also infusing common platforms and systems which will create interoperability. The other point you said about cost is very interesting. How do you see the cost factor playing out? Does this make it more expensive for patients and healthcare service providers to have so much of automation coming into play?
I think automation will actually enable a single provider or a single the call center staff or clinical team to see a lot more patients. So I see actually AI and automation is going to provide economies of scale. There will be, the Anthropic CEO just 2 weeks back talked about the risk to white collar jobs because of automation. I think I agree with him. That's real. But I think, industrial revolution has shown us that the displacement of workers goes from one area to other. So I think I'm hoping prices as a consumer myself doesn't go up. And I believe that the economies of scale AI provides, we actually will be more efficient overall, and we can scale a business very quickly. Economies will actually see much more quicker acceleration in growth. So I think it would be a net positive.
One final thought from you, Avi. There is great hope in automation, but there is also this need to manage and balance automation with human connect. And I think that's something which you have been focusing on, especially where trust is involved. So, do you see that balance coming through? Do you see efforts coming through to ensure that patients feel that there is a personal touch at the same time automation allows more efficiency? How do you see that balancing out? Because without these two coming together in a interesting way, in a fruitful way, there would not be enough satisfaction both for the service provider and the service seeker.
As I said, I think at Verato and myself as a healthcare technology executive, I believe the complete unified, trusted, panoramic view of people and organization are the most essential pillar for all these technology initiatives to work and make sure it has the right outcome. And without that trust, as you mentioned, with these applications, uh, there won't be the achieved results because adoption will be really low. So if healthcare and even outside healthcare technology leaders and business leaders wants results, they really need to focus on trusted data. And that actually, I believe, would be a pillar to ensure adoption of these initiatives.
Thank you, Avi. That was excellent. Thanks for joining us today. It was a pleasure to have you on this podcast, but also to learn about some of these new efforts and innovation and automation in healthcare. And thank you to everybody else who was joining us today. I was in conversation with Abhishek Mukherjee, Chief Product Officer and Technology Officer at Verato. Look forward to another conversation for our podcast in the coming weeks.
Thank you, Pranjal.